Good evening. My name is Angela Hefner, and I am here to present a case on ADHD and MDD on a female patient. This is the badge I have right now. Um, AS, for terms of privacy, she's a female that presented with attention deficit disorder and MDD. She currently lives with her husband and denies any self harm or engaging in any. She reports her sleep was okay. She does not use tobacco, illicit drugs. She is on Prozac 20 daily for her depression and anxiety, and she's also on clonidine point 0.1 for her ADHD symptoms. Her past psychiatric history, she denies any physical or sexual abuse, any illegal charges, firearms, weapons, any substance abuse. There's no past hospitalization, psychiatric or otherwise, no previous medications or diagnoses, and no substance abuse history, and no family history. Patient grew up living with her parents, denied any physical or sexual abuse. She does not use alcohol, smoking, or tobacco. Patient denied legal charges as stated before. She has no allergies. Her current medicines were stated above, the Prozac 20 and the clonidine 0.1. And she has no known drug allergies, no known allergies. She began her menses at about 12 years old, denies any STIs, and is monogamous with her husband. They've been married for about 12 years. The PHQ-9 and the Vanderbilt scales were identified. She scored a 2 on the PHQ-9, and she appears her stated age. She was dressed casually. Her attention was good. Her focus was good. Her speech is normal. Rate and rhythm, no pressure, no hallucinations or paranoia with delusions. She has good judgment and insight, good memory, and no SI or HI. For my differential diagnoses, I went with obviously ADHD combined presentation, and that is, decreased focus and inattention normally in the adult. You don't normally see the hyperactivity at about high schoolish age. Major depressive disorder, which she is diagnosed with, there's a prevalence of over 10% in over 30 countries, so that's a huge amount. Tearfulness, lack of pleasure, lack of doing things, insomnia, feeling hopeless, the DSM-V states. And for my third differential, I chose adjustment disorders unspecified because she has stressful situations, and that is identified under the DSM-V with onset of symptoms within 3 months of a stressful event. My reflection, I think that everything is good. We need to continue to do the ADHD and MDD assessments at each visit, but there's no need to make any changes. And that is it. Thank you for listening and have a great evening.